All right, let's dive into something pretty fascinating today. We're going to explore this idea of spiritual well-being and what the actual science says it means for our overall health.
I mean, we all think about this, right? We talk about eating right, getting enough exercise, trying to manage our stress. But is that really the whole story? Are we maybe missing a huge piece of the puzzle when we talk about wellness?
Well, it turns out that a whole growing body of scientific research is pointing toward this crucial dimension of our health that has a really powerful and measurable impact on our lives. Okay, so first things first, we've got to look beyond just our physical health. I mean, real well-being is about so much more than just not being sick. It's about our quality of life, our ability to bounce back from things, our resilience.
So what is this hidden dimension we're talking about? Researchers call it spiritual well-being. Now, I know that can be kind of a loaded term, so let's get a really clear, research-based definition out on the table. So notice how broad this definition is. This isn't tied to any one specific religion or belief system. Instead, it's really focused on a sense of connection, to yourself, to other people, to nature, or even to something you feel is bigger than yourself. It's that whole combination that researchers are finding is so incredibly powerful.
Okay, so we have a definition. Great. But here's the million-dollar question. How does this kind of abstract idea actually connect to our physical health? Let's take a look at the evidence.
And this isn't just some one-off finding in a single study. Nope. As scientists started looking at all these different groups of people with different health challenges, a remarkably consistent pattern just kept showing up.
Let's start with a big one, a leading health issue all over the world. Researchers took a look at patients who were dealing with heart disease, and they asked, what factors really truly impacted their day-to-day lives the most? And what they found was huge. It wasn't just some minor factor on the side, it was a main predictor. Think about that for a second. A person's sense of spiritual well-being could powerfully forecast how well they were going to cope and the quality of life they were going to have.
Okay, so what about another chronic condition? Let's look at people who are managing diabetes. Does that same pattern hold up? And yep, there it is again. A super clear, positive relationship. The data showed that as a patient's spiritual well-being went up, so did their quality of life. The link was direct, it was significant. Let's just cement this pattern with one more example. Patients who are going through hemodialysis. This is an incredibly demanding, stressful treatment for kidney disease. So you see the trend, right? Time and time again, across these very different and very serious health conditions, this one dimension keeps emerging as a key factor. It seems to provide this kind of inner resilience that directly impacts how people actually experience their health challenges. Now, you might be sitting there thinking, okay, this makes sense for people who are facing a major illness, but is this just for patients? What about the rest of us? Oh, not even close. The research on this is just incredibly broad. Studies have found this exact same connection in caregivers, in students who are drowning in academic pressure, in pregnant women, healthcare workers on the front lines, and even in young adults navigating that tricky quarter-life phase. This isn't some niche idea, it's a deeply human one.
But, and this is really important to be clear about, the relationship isn't always simple. Like anything in human psychology, there are nuances. It's not like you can just flip a magic switch and suddenly have better health. So, one key distinction researchers make is between positive and negative spiritual coping. Positive coping is when your beliefs give you strength, a sense of connection, a framework for dealing with stress. Negative coping is the opposite. It's when someone feels abandoned or punished, or that their struggles are some kind of sign of disfavor. And that difference really matters because negative coping is often linked to poorer mental health outcomes. And get this, here's a fascinating little wrinkle in the research. One study actually found that people who identified as moderately spiritual reported lower mental health scores than those who said they were non-spiritual. This kind of suggests that being in that questioning, uncertain, in-between spiritual state might be more stressful than having no spiritual framework at all. It's definitely something researchers are still looking into.
So after looking at all this data, what's the bottom line? What should we really take away from all this?
It's pretty clear that spiritual well-being isn't just some vague nice-to-have. No, it's a measurable factor that consistently predicts our quality of life. It can act as a protective buffer for our mental health. And, it's a critical component of what we'd call truly holistic care. Care that treats the whole person, not just the symptoms.
And really, that brings us right back to where we started, but hopefully with a new perspective. Beyond the diet and the exercise, what are the connections, the beliefs, or the practices that truly support your deepest sense of well-being? The research suggests it's a question that is absolutely worth asking. Thanks so much for digging into this with us today.